So we're going to talk about genetics and the environment in terms of uh, bunions and bunion development. So first thing we're going to talk about is uh, the genetic component and how it affects the musculoskeletal system. So we're talking about the musculoskeletal system of your entire body. Um, how flexible are you? How loose are your tendons and ligaments and things like that? How loose are your joints? I mean, all that stuff works together. I don't care if we're talking about the big toe joint or the knee or the hip or shoulders or whatever. That overall level of flexibility or stiffness, if you're more flexible, you're going to have a tendency towards uh, bunions. Okay, that's the deal. So how does this affect us personally? Well, men are generally not as flexible as women. So women are going to tend to be more flexible, and therefore they're going to tend, just due to that, they have more of an issue with bunions. And then women also get pregnant, and that increases the flexibility even more. So that adds an additional factor into it. Okay, so that's the musculoskeletal system. That's pretty much genetically determined. Now, how about the foot and ankle? Well, there's the genetic way that your foot and ankle were made. How all those muscles and bones and ligaments and all that kind of stuff, how they interact in that kind of mechanical, biological environment of just your foot and ankle tends to give you two types of angular issues with your feet. Do you pronate or do you supinate? If your genetics says that your foot and ankle mobility is more towards pronation, you're going to have more of a tendency for uh, bunions. There's three kind of shapes to the metatarsal joint. One is it's flat, okay, it's a joint that's flat like this. The other is that it's kind of pyramid shaped like this. Either of those two shapes don't lend themselves to rotation, okay, right? If you got another one on top of this, it's not going to tend to rotate off. But if you have a more common joint that's more oval or somewhat circular, then your big toe is free to rotate pretty easily on that joint. And so there you go. It's going to be easier for you. So see how multi-factor all this stuff is? Yeah, multiple reasons. And then finally, there is the actual outside influence of wearing pointy-toed shoes and tight shoes and high heels and things like that, all of which uh, enable you, well, all of which kind of impose a crooked big toe because you're squishing your toes together. Okay, um, so that's the deal there. So there's one more thing I want to talk about, and that's the musculature of the big toe itself. So let me ask you a question. When you take your shoes off, do your toes go back to their normal alignment? No. Well, when you weren't paying attention to this, when you were 20 or 15 or 12 or 25 or 30, uh, maybe they did. Maybe you wore those pointy-toed shoes all day, and then you took your shoes off, and the toes sprang back to normal, and your running shoes or your athletic shoes were more comfortable, or your sandals around the house were more comfortable because they weren't, all squished by pointy-toed shoes. At any rate, when you take your shoes off, now that you have a mature bunion, your bunion doesn't go, your toes don't go back to normal angles. No. Why is that? Is that because the joint is frozen in a certain angle? Well, you know what? Some of you might have that kind of a problem. There might be some kind of growth in there. It could be arthritis and things like that. But the main reason is that there's a couple sets of muscles that control the angle of your big toe. And some of those muscles pull that big toe to the outside, and another counterbalances that and pulls it to the inside. So all things being equal, which of course they're not because you have bunions, but all things being equal, your toe, your big toe, would be in its normal alignment. So I've got a little cast of a foot, and I'm going to demonstrate that to you, and I'll show you some pictures too, and we'll kind of talk through it, because this is the main thing. Okay, the reason your big toe is pointing outward is because of muscles that are pulling it outward. So we'll dig into it a little bit.